This is Gurleen Kaur. I'm finally the pharmacist in Australia. I have cleared my intern exams, both the written and oral. This, I think, in March. So I got my results in March and February, and I have cleared them. So I started my journey to become pharmacist in Australia in 23 when I cleared my KAPS exams. So I would like to add on that before I studied from you for my KAPS exam. I gave a KAPS twice.
Yeah.
So at first, I passed my KAPS exam. I was left with only the pharmacology part.
Pharmacology part was left. Yeah.
That's why I chose, okay, I should get some training for the pharmacology, because when you taught us that, okay, how things work in Australia and how we are so particular about the adverse effect, the mechanism and everything, then it's like, okay, and you guys helped us for the KAPS, for the written exam, for the oral exams. So I think if someone will watch my interview, it will motivate them, because it is up down while our internship journey. They were
And you just kept going
yeah,
on. Persistence is the key, I should say. Someone with the passion and persistence and hardworking nature will definitely reach their goal. And I think Gurleen is the best example. I just loved the way she's answered every question in mock. I think ethics, legal, and problem-solving communication. It was so good. Primary healthcare, the way you approached, asked the questions, history taking was so organized. I was instantly saying, "This is gonna be, she's gonna pass the exam." Hello, guys. Welcome to another video of Elite Expertise YouTube channel. I've got an intern success story with me. Often we publish a lot of OPRA success stories and everything. And we have actually received our intern pharmacist results as well. Intern Pharmacist written and oral exam results. So we've received in, I think, a couple of weeks gap, and we've got a very huge success rate. I think only one candidate missed the exam this time. And I think one in oral. Yeah, only one candidate actually. But the rest of the others were really amazing and they've made it in their first attempt. And in that aspect, we've got Gurleen with us today, who's cleared her written and oral exam in her very first attempt. Congratulations, Gurleen.
Thank you so much, ma'am. Thank you.
I'm sure it must be a huge relief for you when you saw the result from OPRA. So,
Yes, it was. It was. I think for both of the exams, when I received my results, I was so happy and was like, okay, I have
thank
done,
God.
yeah, I have done what I aim for. So, yes, it was a big relief.
So I should say Gurleen was very punctual when it comes to classes, and that's the reason for her success. She never missed one class, and she always attended the mock sessions, which we conducted the oral simulated mocks, and she attended all the intern written exam mocks, and she has finished everything like up to date, and that is why she has been so successful in her first attempt. And I actually told her during the sessions that you are passing the exam.
Yes,
You remember?
yes, ma'am.
So, congratulations. I think it's a huge relief for you. But actually, I should say you've been really working hard. I can see that from the way you've answered the questions in the classes and the way you finished all the mock tests and everything and participated and took the feedback, corrected your mistakes. So I think your journey started in March 2023 when you finished KAPS, right? KAPS in March
Yeah. Yes,
2023.
yes, ma'am.
I think I should pause and let you talk. So just talk about yourself and why you've reached this stage, why you're in Australia, where are you, etc., etc. Yeah.
Sure. So this is Gurleen Kaur. I'm finally the pharmacist in Australia. I have cleared my intern exams, both the written and oral. This, I think, in March. So I got my results in March and February, and I have cleared them. So I started my journey to become pharmacist in Australia in 23 when I cleared my KAPS exams. So I got my training for my KAPS from Harika ma'am and Arif sir both. So it was the beautiful journey back then. So afterwards, I applied for the nominations and for the visa, and everything happened, and I reached Australia in September 23. Then I moved to the regional area because my visa was,
Victoria, right?
yeah, Victoria, Belgrade, based on my regional visa. So yes, I started practicing here, but I waited for 6 months to get the intern role in the regional area. So I would say like my sister helped me a lot in this aspect because she's been in Belgrade since 8 years. So it was she helped me a lot getting through this and helped me finding internship as well. I think to start the journey as intern pharmacist is when you come from like a brand new come here like to a brand new country. It's a bit hard. It like requires a lot of patience. So once I got my intern role, it took me 6 months to get my intern role. So once I started, and I think that intern journey is all journey, not journey,
Journey, yeah.
it, journey is also a different. I think it's totally different because if we talk about back in India, we have totally different health
Care system and
and
practice,
practice,
pharmacy,
but
yeah.
here in Australia, it's totally different. I would say it's upside down. So it was so when you start, it's like it seems like everything is so hard. How you going to tackle, and plus you have so many things to do and so many paperwork. And but once you get familiar to the things here, how the what's the system, how it runs, and everything. So yeah, I and then the journey became easier, and you start doing your things. Then you understand people, you understand the language. I think the Aussie accent is totally different from what we think. So everything comes with practice. So yes, then again, I think before my written and oral exam, I started practicing 3 or 4 months before my exams with again with the light expertise with Harika ma'am and Harif sir. So yeah, there I am, cleared my exams, and yeah, soon going to be start as working, not start, yeah, start working as a
Working
farm.
as a pharmacist. I think in a couple of weeks you're going to start your work.
Yes, I'm just
Just
waiting to
taking
apply
some
my
break and yeah, general registration and congratulations. It's not an easy journey, I should say, but I think you've got a good support system in form of your sister. You're well read. Was it a 190 visa? Yeah,
oh ma'am, it was 491.
regional visa. Yeah, 491 regional visa. And then again, regional, it's not much different. I mean, like it's Ballarat, very close. Yeah.
But it is like I think in 23 it was, I mean, I would say I was lucky. I don't know. I cleared my exam in March. I got my nomination in April, and
April,
it
it
was
was
like
very quick.
it
Yes.
was so quick, and then I got my visa in I think 4 months.
Yeah. God bless you. Touch wood.
Really, it was like, I don't know, but it was like everything was in my favor. So I get everything so easy, and I came here.
Yeah, true. But I think you've really worked hard in securing internship, waited for 6 months and then worked hard for the exam.
Yes,
I
ma'am.
think it's definitely worth. I mean, I think you've not done anything so easily. I think it's you
No,
deserve
ma'am,
it. Yeah.
no. Because I would like to add on that before I studied from you for my CAPS exam, I gave a CAPS twice.
Yeah.
So at first I passed my CAPS exam, I was left with only the pharmacology part.
I mean, pharmacology part was left. Yeah. Pretty
That's
much.
why I chose, okay, I should get some training for the pharmacology because when you taught us that, okay, how things work in Australia and how we are so like particular about the adverse effect, the mechanism and everything, then it's like, okay, and you guys help us like helped us for the caps, for the written exam, for the oral exams. Yes, thank
Actually, not many interns give interviews, and once they become pharmacists, they don't even like turn and see. And we are looking for some inspiration and some credibility
you. Yes, ma'am.
interviews from people like you who are pharmacists here. And thank you so much actually for accepting this interview.
No, ma'am, that's really okay. I think if someone will watch my
And look
interview,
up to, yeah,
yeah,
is
and
be inspired and maybe their life would change. That's
yes,
great.
exactly.
It's
I
all
think
about you, yeah.
yes, ma'am, and it's hard because while we were practicing, we all were discussing that it's hard to go through the internship, getting along with our preceptors, supervisors, and everything. So I think if someone will watch my interview, it will motivate them, like because it is like up down while our internship journey. They were
And you
like,
just kept going on, going
yeah,
on. Persistence is the key, I should say.
yeah,
Someone with the passion and persistence and hardworking nature will definitely reach their goal. And I
oh,
think Gurleen is the best example. I just loved the way she's answered every question in mock. I think ethics, legal, and problem-solving communication. It was so good. Primary healthcare, the way you approached, asked the questions, history taking was so like organized. I was instantly saying, "This is gonna be, she's gonna pass the exam."
yeah.
So, and the same thing happened.
Yes, because I would say, ma'am, when I start with you, like with Arif sir from the primary health care. So I was so new for everything because when we practice in pharmacy, it's totally different what we do theoretically. So I used to like have a discussion with my supervisor, preceptor. Oh, he's a lovely man. So I used to have a discussion with him like, okay, so what my teachers are teaching me and what we are doing in the pharmacy, it's totally different. And because at pharmacy we have so many patients, it's everything practical, and our supervisors help us there because they
Yeah,
know the drill how things work and
yeah.
practically. But if we go by theory, it's like we are so new to everything and we don't know the how they ask in the exam the questions, how we need to
Yeah,
apply
theory is more about rules and regulations to
regulation.
clear the exam. And of course, actually, ideally, that should be practiced.
Yes.
Sometimes, when we human beings practice, there is some discrepancy between theory, I mean, the rules and regulations, the guidelines, and then the way we practice. And interns often get confused. And if you don't have good exposure to the theoretical aspects, rules and regulations, PBS, primary healthcare referral points, then you think that whatever you're doing in workplace is correct.
Yes, ma'am.
And then, like, you end up giving like some other answer in the exam. Of course, like every patient gets a customized treatment, but sometimes some rules like kind of flip and flop. So I think it's good to have both exposures, I
Yeah.
mean like real life and knowing the rules and regulations.
Yes, ma'am.
Yeah, I think.
Yes, I
Yeah.
think theory helps a lot in exams, like how Arif sir taught us about each and every over the counter medications, how we ask questions, how we need to find out what's the diagnosis, and what we need to prefer for the diagnosis, what we when we need to refer. Like referral is the most important.
Referral points, yes, yeah.
Yes. So then legal and ethical is also very different. And I think I would say one of my supervisor, she taught me so many legal things plus what you have taught us about the legal things. I mixed them both and I worked.
You got the best out of it, yes.
Yes, exactly. And then the part C was for the oral exam. It's like I have never practiced. I would frankly say that I have never practiced like asking so many questions in
Questions.
practical rather than in theory. So I would, yeah. So whatever Harika ma'am and Arif sir has taught us, it has like blessed us and helped us in every way, I would say. And the for written exam as well. So written is even if it's a paper like open book exam, we can get our references there. I think we should have some basic knowledge how to how to answer and how to find things like you have taught us look for the synopsis, for where to look for, like if we talk about some drugs, where to look for that answer. And while practicing, like we have done so many mocks, so many practice, and yeah, I think practice is the key, and practice makes you succeed in every aspect. Yes.
True, and I think you've got the best workplace as well, like very friendly pharmacy, just like you, very patient, dedicated team of preceptors, and they have really played a major role in your success. And I think it's all the team effort, your pharmacy, and then you've got some guidance from us, and you especially, it's all about you, your success. Congratulations, and I think what I learned from Gurleen is simplicity, hard work, patience, and persistence. And I don't even know if she gets angry with anything. Are you ever angry with anything, Gurleen? Like I've never seen you.
No,
Never seen
not like it's like, ma'am, I
you.
get angry, it's like, and it's gone in a second.
Gone.
Yeah.
Yeah. So I think she's doing some kind of meditation. She's achieved this stage. Congratulations. Thanks for coming down and giving this interview. It must be very cold for you tonight. I mean, Balraj is freezing.
Yes, ma'am. I think it's okay. I think tomorrow is 6 degrees here, so it's not that bad. I think it's really bad in June and July when we get frost.
Yeah.
Frost.
Then people come to visit snow and so maybe we'll
uh,
visit you soon.
it's very bad.
And yeah, congratulations once again, and congratulations on becoming a fully qualified pharmacist.
Thank you so
The
much.
most deserving success. Thank you for coming and giving this interview, and I love you. Thank
Pleasure, ma'am. Thank you.
thank you.